A 70-year-old male smoker with diabetes presents with sudden onset left-sided weakness 2 hours prior, who underwent plain brain CT and CT angiography. Show the images. Describe the findings.
Okay, looking at the images, the non-contrast axial brain CT scan shows normal brain parenchyma with no evidence of acute hemorrhage or established infarction. The artificial intelligence software has calculated an aspect score of 10, confirming the absence of early ischemic change in the middle cerebral artery territory. On the companion CT angiogram, the AI software highlights a focal occlusion within the right M1 segment of the middle cerebral artery. A complete cutoff of contrast flow is visible in the proximal right middle cerebral artery, while the contralateral left middle cerebral artery is fully patent. The findings indicate an acute occlusion of the right M1 middle cerebral artery with salvageable brain tissue.
What is the diagnosis, and what are the main criteria for selecting patients for mechanical thrombectomy?
Well, the diagnosis is an acute ischemic stroke secondary to occlusion of the right proximal M1 middle cerebral artery. Patient selection for mechanical thrombectomy depends on the time from symptom onset, clinical severity, pre-stroke functional status, and radiological findings. For anterior circulation strokes, mechanical thrombectomy is indicated within 6 hours of symptom onset in patients with large vessel occlusion. Clinical criteria include a pre-stroke modified Rankin score of less than 3 and a National Institutes of Health stroke scale score of 5 or higher.
Explain the Alberta Stroke Program Early CT Score System and its clinical utility.
Okay, the ASPECT system is a 10-point quantitative tomographic score used to assess early ischemic changes in the middle cerebral artery territory. The MCA territory is divided into 10 anatomical regions, 7 axial sections, and 3 subcortical structures, caudate, lentiform, and internal capsule. For every region demonstrating early ischemic changes, such as loss of gray-white matter differentiation or sulcal effacement, 1 point is subtracted from 10. A score of 10 represents a normal CT, while a score of 0 represents complete MCA territory infarction. An aspect score of 6 or higher is generally considered suitable for mechanical thrombectomy, as it indicates a large volume of salvageable brain tissue.
What is the role of artificial intelligence software in acute stroke imaging?
AI software provides automated, rapid, and standardized triage of acute stroke patients. It acts by automatically detecting large vessel occlusions on CTA, alerting the stroke team within minutes. Additionally, AI software calculates automated aspect scores on non-contrast CT and maps perfusion mismatches on CT perfusion scans. This reduces the time to treatment window, which is critical because every minute of delay is associated with loss of millions of neurons.
Discuss the management, further investigations, and how you would manage this patient as a radiologist.
The patient should immediately be referred for mechanical thrombectomy and standard intravenous thrombolysis if within the time frame. Following acute intervention, further investigations like carotid duplex ultrasound and echocardiography are performed to look for embolic sources. Secondary prevention with antiplatelets, statins, and diabetic optimization is subsequently initiated. As a radiologist, I would immediately call the stroke neurologist to alert them of the M1 occlusion and the normal aspects score, activating the thrombectomy pathway.